Joining us now, Tamil Nadu's Health Secretary, Dr. J. Radhakrishnan. Doctor, thank you very much for your time. What is your assessment now, Doctor, after the long total lockdown across Tamil Nadu?
See, Chennai sort of has started coming down consistently for the last 1 week. Despite the test being increased, it is showing a figure of around 1,200 or not. But it is too early for us to say anything on Chennai. What we have said is we should continue to do the aggressive testing and continue to focus on these fever camps, and slightly we are moving above, over and above the fever camps and focusing even on the market and other areas where, since Chennai otherwise has opened up for other activities. So that is one focus area. But the other area where we are focusing is on the other districts, especially Madurai and also neighboring Chennai, like Chengalpet, Kanjipuram and Tiruvallur. Apart from that, Tiruvannamalai and even Kanyakumari. These are some of the, so it's basically a dynamic kind of thing. Here we are guarded. We are telling people to do the non-medical activities very intensively, but also focusing on other districts and replicating the same issue.
Is Madurai now emerging to be a new epicenter, Doctor?
See, Madurai has been a focus area almost for last 15-20 days. But basically, the only solution for this kind of challenges is, of course, Madurai the lockdown has been continued till another 2 days. It was extended. Beyond, it started around 24th, if I am correct. Madurai, the challenge is again certain specific areas like Sellur and even certain other congested areas. There, our worry is that we have intensified this testing and almost tripled the camps. So we are trying to say that the similar kind of approach of aggressive testing is the only solution. There's no way of running away from trying to identify the positives, ensure that they get adequate treatment. And parallelly, we are also focusing on improving the infrastructure. There again, increasing the oxygen beds, those kind of things.
There's a perception that in districts, testing was not ramped up as much it was done in Chennai.
See, again, it's very easy for people to go by perception, but Tamil Nadu, if you look at, although there is a difference between ICMR, the website data and what we do, almost 2 lakh negative entries, the labs are now, we are doing almost 45,000. Today it is around 45,000 RT-PCR tests. So we have given a very basic thumb rule of if X is positive, 10 times X at least should be checked. And that again is not aimless checking. It has to be how many new cases are coming, how many cases are out of contact. If more and more new cases come, then it's an area of worry. If it is coming out of contact, obviously from one person, at least 10 contacts will be there. So that increase we don't worry, but at least that helps in isolating them.
Any particular reason why the daily testing breakup district-wise is not given?
No, there is no particular reason. Basically what is happening is suddenly from what we are doing around 13,000 tests a day, we went for the last 1 month to 45,000 tests per day. So what is happening is the labs are also finding it difficult to feed all the negative data. So positive they are feeding, negative there is a backlog of almost 2 lakh numbers. So when you release the data with a wrong denominator, it will give an incorrect figure. So basically we have put additional data entry operators to help the labs so that they can cope with the data entry issues and come back to a correct position. Otherwise there is no such issue that you shouldn't show the district data. Generally we have the data. We informally do have the specifics. I am sure that 10 times the testing is a thumb rule, whichever is the district where.
And any particular reason, Doctor, even during this total lockdown, numbers have been rising in districts?
See, total lockdown was only there in Chennai and the southern, districts adjoining Chennai and of course Madurai. But the other place, see, basically a lot of movement does take place, and despite your best efforts, follow-up of non-medical methods is the only sustainable solution. So that basically, despite all our drives, we find that even in the districts, I recently had been to Madurai also. Madurai also, what I find is that, that the seriousness with which Chennai started following up was missing in Madurai. So now we have put dedicated teams to even do the education on the non-pharmaceutical approach.
And lastly, how prepared are we in districts in terms of number of beds, ventilators?
See, that is being regular. There is a separate infrastructure committee looking after it, and Chief Secretary reviews it. Honorable CM is very particular that wherever we reach 50 to 60%. Not everybody goes to a COVID hospital. Quite a lot go to COVID health center, and in fact, almost 50 to 60% go to COVID care centers. So our focus is to ramp up COVID care centers, so that not all occupy the COVID health the hospitals. But otherwise, we have Tamil Nadu is one of the largest beds available, and again, if you look at over and above the oxygen beds which we have, and of course other facilities like ventilator, high flow nasal cannula, Honorable CM has also sanctioned 75 crores to further increase the oxygen supported beds. So that is the area where we are focusing on. But otherwise, we are on the safe side as far as the infrastructure is concerned. But again, in this particular thing, we have to keep dynamically looking at it. Even Chennai, we are very guarded, and we are feeling that people need to continue the same kind of follow-up of the non-pharmaceutical methods.
Right. And have things improved after this lockdown in terms of compliance?
Complaints definitely in Chennai. There is a large, especially in the slum areas, the numbers have really crashed. Only thing is that the moment things come down, people should not be casual. Right. That's the kind of approach. We can't just be saying that we are positivity is the only area which we look at. And case fatality is another area which is a work in progress. Despite your best efforts, there are people coming in late. So we are taking a lot of efforts on the medical side also. But that is one area where we are still working to ensure that the mortality comes down.
Is that a concern? There's an incremental rise almost every day.
See, our concern is basically, we don't look at the state level case fatality, but districts where, people who die within, 1 hour of hospital, or people who are brought dead, or people who die within 24 hours. So that analysis we experts are doing and looking at how those things can be addressed. Instead of, trying to educate them to come early and provide oxygen supported entry, those things are being done, but also look at how to address it.
Thank you so much, Doctor, for your time.
Thank you.
That was Tamil Nadu's Health Secretary, Dr. J. Radhakrishnan, talking to us in Chennai with camera person Edwin, Sam Daniel, for NDTV.